Alright guys, let's get busy talking about MDMA, which is also known by the street name ecstasy. Let's start by talking about the mechanism of action. So this is going to be a 5-HT2A serotonin receptor and D2 receptor agonist. Now, you may remember that LSD was also a 5-HT2A serotonin receptor agonist. So it's important to recognize that these two drugs have similar mechanisms of action, but MDMA is going to have additional D2 receptor agonism. This is going to lead to increased serotonin and dopamine in the synaptic cleft. Now, in terms of our presentation, the presentation can also be similar to LSD. We're going to have things like euphoria, hallucinations, hyperactivity, distorted perception of time in the five senses. This may seem similar to a person who was on LSD presenting with strange hallucinations. Now, the way that I differentiate this from LSD intoxication is any mention of the D2 receptor agonism. That's going to be a key differentiator in terms of mechanism of action, because that's something that LSD does not have, as well as presenting physical symptoms. So, as opposed to LSD, in terms of somatic symptoms that help differentiate MDMA from LSD, we're going to have increased thirst as well as bruxism. So, increased thirst is going to be due to the fact that people on MDMA tend to be very hyperactive. They tend to be dancing and really going. So, they're drinking a lot of water. And they also have bruxism, which is a fancy word for teeth grinding. So, we can see patients who maybe are complaining of TMJ or who have ground down teeth or are really clenched when they're in the ER. That's going to be a giveaway for you. They're also going to have hypertension and tachycardia as well as hyperthermia. This is because patients on MDMA are in a really heightened, elevated state, and this is what causes this triad of hypertension, tachycardia, hyperthermia. Now, additionally, we can get hyponatremia, because you can imagine if you were tachycardic, if you were hyperthermic, if you were drinking a lot, you're just drinking all this water to deal with this really elevated, hot, active state. And so you're drinking a lot of water, but you may not be consuming enough electrolytes, enough salt, enough sugar to offset all that water, and so you can present with hyponatremia. Additionally, since this is a serotonergic drug, we have to be on the lookout for serotonin syndrome as well. So you want to be asking careful history about patients who may have serotonergic medications on board, like an SSRI or an SNRI, maybe a tricyclic antidepressant. Those are going to be important questions for a patient who you suspect has MDMA intoxication. In terms of withdrawal, this drug makes patients really happy. So as they're pulling off of this drug, they're going to have depression, they're going to have difficulty concentrating, they're going to have fatigue because they tend to be in a high energy state when they're on the drug, and then they're also going to have anxiety and appetite changes, because when patients are on this drug, they tend to forget to eat, they tend to be in a really euphoric state, and so they're going to have come down symptoms of anxiety and appetite changes to go along with that.